Good afternoon. Today I'm joined by State School Superintendent Chris Rakedahl, Edenville Schools Superintendent and President of the Washington Association of School Administrators, Creston Barr, Health Secretary John Weisman, and Senator Lisa Wellman. We cannot hide from the central truth of this moment. We know that COVID-19 is at least 10 times more dangerous than the flu. And anything less than strong action amongst all of us is not appropriate or up to the task that we face at this moment as a state. Our state has been taking bold and aggressive actions against COVID-19, including workers who are telecommuting, business leaders and public and private partnerships and nonprofits who are helping in so many ways in this efforts, people who are caring for their families, doing the things that are smart, and multiple government agencies who are working together on this challenge. And today we are taking another such action. In order to mitigate the impacts of COVID-19 in our state, today I make the very difficult decision to order closures of schools in Snohomish, King, and Pierce counties. This includes public and private K through 12 schools. Under this order, schools must close and end classes by the end of this coming Monday. The first possible weekday back will be April 27th. This 6-week closure is not a decision made lightly. This came after many discussions with Secretary Weisman and his team at our State Public Health Authority, Superintendent Rakedahl, superintendents from districts of multiple districts that will be affected, many parents, county executives from each of the counties, the Washington State Education Association, PSE, and others. We have reached a tipping point where the spread of this virus demands that we take action. We're seeing the number of confirmed cases within the Puget Sound area increase significantly just in the last week. And we do not expect this to slow down and will not slow down unless we take action to defeat this virus. Although this virus presents much milder symptoms in children, health professionals have told us that closing schools could create a significant cut in the peak number of ultimate infections. And closing school districts will help slow the transmission of this dangerous virus. School districts within the region are also experiencing unparalleled student absences even today. Many districts are also struggling to staff their operations. And during times of uncertainty and risk, we all need to make tough decisions, and this is one of them. Something of this magnitude cannot be surmounted without all of us pitching in. I've already asked businesses in the Puget Sound to expand options for telework. And with school closures, those options become even more important for parents who have children who will be affected by this order. With that being said, there are critical services our schools provide that will need to continue during this closure. That includes nutrition and childcare. I've asked the superintendents from King, Snohomish, and Pierce counties to have a plan for the continuity of these services. Nutrition services for students who rely on school meals, and support for students experiencing homelessness. Based on what we are hearing from OSPI and other partners, we have every reason to believe that we will be successful in this regard of providing services to these children in need. We are in talks right now with philanthropic and service organizations ready to help students impacted by these closures, such as distributing boxed lunches. This effort may also ultimately involve our National Guard. I've also asked for a plan to provide opportunities for extended learning, similar to packets that teachers send home on Thanksgiving and winter breaks. Now, we know that districts vary widely in their capabilities to provide these teleeducation systems outside of the classroom. Therefore, schools should not be providing online services unless it really is effective, and we hope that it will be. As I've said before, closing schools has a major impact on our ability to staff hospitals and other emergency service providers crucial to public health crisis if in fact we do not provide adequate child care for the children of these employees. We absolutely cannot afford a situation of healthcare providers not working in hospitals because they do not have adequate child care. During these closures, I've asked superintendents to provide child care at no cost to families who are in the medical field or who are first responders. This is extremely important for the health of Washingtonians. We simply cannot afford health professionals and first responders who cannot do their duties. Now, people should understand nothing in this order precludes public, private, or charter schools from using their facilities to provide child care, nutrition, and other social services. If a school in any of these 3 counties is open and providing child care, it is my expectation that staff will take every measure possible to provide social distancing, ensure consistent hand washing, send students home if they're sick, and routinely disinfect commonly touched surfaces. I think now is the time for us to come together, and I encourage local education associations to work with their superintendents to be as flexible as possible within their collective bargaining agreements for the safety and health of students and staff. I want to repeat, these closures are limited to the 3 counties named, but it's very important for all school districts across the state of Washington to have very active, robust, and meaningful plans for contingencies that may include them in future closures. And those could come in the near term. We are aware that other counties may end up becoming part of this effort, and we may be making similar decisions shortly. I will use the same criteria for closures that we've talked about: the number of cases in the affected counties, the ability to perform contact tracing of people who are infected, student and staff attendance. And I'll use that criteria in determining if action is required in additional counties. My emergency proclamation includes the flexibility to take further action in other counties, and that's why we need our districts across the state to be ready as soon as possible. So I trust that districts in the rest of the state will be having conversations with their communities in this regard to be ready. We know that with every step we take, our top priority is reducing the number of infections and deaths. And I know that school districts will be sharing their plans in coming weeks with their families. With that, I'll turn this over to Chris Rickle, who's been doing a great job in our planning process. Thanks, Chris.
Thank you, Governor Inslee. I'm Chris Rakedale, State Superintendent of Public Instruction. I want to say first off, our kids have been very safe in our schools through the duration of this process and the duration of this viral outbreak. Early indications from our health officials made clear to us that that was the safest place for our kids, and it remains a very safe place for our kids. As the governor indicated, the infection rate for young people is very low. Their incidence of being symptomatic is very low, but things change. And as we understand more how this unfolds, it is important that we keep the health not just of our students, but their parents, their grandparents, and the overall communities in our minds. And one of the protective ways we can do that is to take the bold actions that the governor has just indicated to ensure that we have every focus in the world at the social distancing strategies that ultimately protect our entire community. I say to young people when they ask me about this, you may not ever be symptomatic, but if you are a carrier, you may be putting your grandparent at risk, and there's a time to take more significant action. It's a very different world than it was just a week ago or a couple days ago. We have 15 districts in the region that have announced closures. They've joined districts who had already had short-term closures. These are, this closure, as the governor has indicated, is up to 6 weeks. It involves 43 school districts in those 3 counties. It is roughly 600,000 students. It is more than half of our student population in the state of Washington. It begins, as the governor indicated, no later than the end of the school day on Monday. Districts have asked us for a little time, in some cases, to prepare. They still have the local choice, of course, to close sooner than that. It ends on April 24th. That's a Friday. That means Monday is likely the first back-to-school day, but we will constantly review that based on the governor's leadership, his Secretary of Health, and the feedback that we get about the spread of the disease. Schools and families throughout the rest of the state, as the governor indicated, should be actively engaging in contingency planning right now. There's very low incidence of cases in other counties, and I think we all expect that to change as testing increases. Now is the time to prepare for that, to prepare for childcare, to take those necessary steps as school districts, if not already, and we are confident they have. Engage your local public health. Make sure you are prepared now that we have a lot more information to make decisions more quickly. Student attendance in the 3 counties affected has changed significantly. We have experienced an 82% increase in absences in King County alone. It doesn't mean 82% of students have been absent. It's an 82% increase from 6.2% to 11.2% in a very short period of time. Some districts, their absences exceeded over 20%. Schools in Snohomish County had a 56% increase in absences in that time, and Pierce County, a 13% increase. And let me just say right now, a thank you to the governor for being really bold here. Pierce County does not appear to have as much infection right now. That's exactly why you make this bold decision in an area where we think it is very plausible the numbers will grow, and that's why he's made clear that he will use additional criteria should the need for other counties to be included. But right now, these are the most impacted areas and the places we can get ahead of this. Staff attendance is down. We have a disproportionate number of our bus drivers and our substitute teachers who are over the age of 60. And you've seen indications from local public health officers to take special care to protect them, as those numbers of adults have found themselves unable to come to work or made the smart choice not to come to work. For some of our districts, it's been nearly impossible to have a continuity of services. And when you get to that place, you then have a very inequitable public education system. Guidance released by our public health officials, again, focused on over age 60, and we've seen the impact from that. Statewide, more than 16% of our certificated staff are over the age of 60. So not just bus drivers and substitute teachers, but 1 in every 6 teachers is over the age of 60. And that makes it significantly more probable that without the bold action the governor's taken, we would see districts individually making decisions without this coordinated effort. The outbreak continues to expand. Secretary Weisman has been remarkable in keeping our K-12 system through my office updated on the numbers. You've seen those numbers. You've seen where they are located. I want to make clear to folks who might have been thinking this is like a flu. You've heard public health experts say consistently this is not the flu. We don't have a vaccine for this, and the expectation at this point in time is that is quite a ways out. So when the governor makes this decision, and we partnered with him in helping him understand the implications for schools, it's also under a belief that our systems need to be prepared for a potentially longer closure in the near term, and the possibility that without vaccine, as we have seen in pandemics of past, we have to be prepared that this is back in the fall or is still with us in the fall. And this opportunity to close right now gives our districts a very serious moment to think about their strategies and professional development to get our staff and faculty prepared for a lot more learning that may happen at a distance. That is not a mandate of the current closure, but that's part of the reason for our thinking right now is we need to be prepared for not just the moment today, but this fall. Contact tracing has become an issue, as you know. We have amazing public health experts and folks at our universities and the CDC who could initially map the contacts that individuals are having with people when they were diagnosed with COVID-19 or they were tested and confirmed. That becomes very difficult with the kind of numbers we're now seeing in King and Snohomish and increasingly Pierce County. These are some of the reasons of what's changed, and I want to be clear about why the guidance now is so different. We want to encourage school districts in this affected region to think about next week as a spring break. Many of them will be on spring break during the duration of this closure. It gives us a really important opportunity to minimize the learning loss for students. But we want all districts to think about next week as a spring break. And the public should not expect that we have these services fully stood up immediately. Districts need time. They need time to think about how to prepare services and supports for those first-line workers, those emergency response workers and healthcare workers. They need time to make sure their food distribution systems are in order. We are prepared. We have been building for this moment very rapidly in the previous few days, but there's going to need to be more work done. We want to continue to honor the fact that we collectively bargain in the state at the local level, but now is the time for labor organizations and all the bargaining units locally to double down in their effort to support and love kids as they always do. And that means working with their superintendents over the next week while families get a respite and they get to think about how they prepare. Our teams need to be getting together immediately and thinking about how to prepare our districts. This is a labor management joint effort, and if you've ever observed a teacher, most of you have them in your family, you know they will run through walls for students, and we expect nothing less in their effort to cooperate here. Everyone needs to be communicating with students and families consistently and regularly. We intend to keep our apportionment system going. I'll be clear and get rid of that term. We're going to keep sending money to our school districts. There is an expectation that with the way we need to deploy these services and continue to have supports, it will still include transportation potentially. It will still include supporting individuals. That means there is an ongoing need to send the resources. We have also heard from both the White House, lots of folks on the economic side of this thing, our private sector partners. They've led the way by encouraging private employers to continue compensating employees and finding meaningful work for them when they can. This will take an enormous economic impact to our state, to our region, and ultimately to the nation. The school system is $1 billion a month compensation system for professionals throughout the state, and we intend to keep that compensation flowing so that we are not a contributor to the economic impact, not in the short term. Our hourly workers are a challenge. I want to be very clear about that. It is a harder contemplation for those who are paid hourly in our school systems. We're working with Employment Security Department and with our districts to try to figure out strategies, obviously, to keep them fully engaged in their work and where they cannot keep compensation flowing. But that is a particular group we don't have a clean answer for right now, but we are working with them, their representatives, and our employment security folks. Finally, I want to say we're going to keep some services going, as the governor said. We already have a system in place and waivers from the federal government for meals. Every single family who needs a meal can come to our schools as we build this out over the next week, including those who were not previously eligible for free and reduced price. We have the flexibility now to provide a meal to families. So if you are a working family and you find yourself in a difficult situation, perhaps your employers had to let you go, there is not going to be a long line or a bunch of paperwork to get nutritious breakfast and lunch for your children. It's going to be available. We can continue the payroll as I indicated. We will focus on graduation for our seniors, which means there could be additional responsibilities. Sorry, seniors, there might be some work for you still to do in this process to get you the credits that you need. We will continue to work with our partners at SAT and ACT so that our juniors in particular have an opportunity to take their assessments, which often happen in the junior year, in preparation for college admissions that they work on in the senior year. State testing is very likely to be suspended completely statewide, not just in the 3 jurisdictions that the governor has referenced in his proclamation. There's a testing window right now in one group that's wrapping up and it will conclude, but there are other tests that have long windows, including all the way to June. There is no meaningful way to produce those assessments with the kind of student absences we expect from this forced closure and the subsequent closures that are likely. We will talk about more detail on that later. Again, schools should be prioritizing their time right now while they are still open in the other 36 counties on instructional services and not worrying about federally mandated standardized assessments. Let me conclude again with this. We haven't seen this in the state of Washington, the United States, for 100 years. These are not moments that everyone is prepared for. There are questions that folks have. There are nervous and worried families, and we are working really hard in partnership to get answers to those questions, to keep services available, and to maximize the supports for families. But this is also a moment where the health science tells us we have to create social distancing in unprecedented ways. You've seen the NFL, the NBA, the NHL, Major League Baseball, the NCAA tournament. You've seen incredible announcements in the last 6 to 8 hours. We are a visible observation for the rest of the country, and that's why we're taking significant steps to close schools on such a broad geographic area impacting so many of our students. We are going to put the health and safety of our families and our vulnerable seniors first and foremost. That's what this action is about. We have a local superintendent here, Creston Barr from Eatonville School District. She heads up our School Superintendents Association, who I know could be available for questions. We have Senator Lisa Wellman here as well. Thank you, Senator, who oversees the Senate Education Committee and has been following this exceedingly closely at this point in time. I will step back, Governor, and facilitate questions.
Thank you. Happy to take questions.
Governor, I know you said it's a fluid situation and that other districts could be
Yes.
closed in the coming days. But as you may know, the state of Ohio, which has fewer cases than we do, made an announcement today that they're closing schools statewide for 3 weeks. Why not take the larger action of closing schools statewide at this point?
Well, it is possible that we could do that tomorrow or the next day, depending on the rate of transmission that we're looking at. We also think it'll be useful to have the rest of the state see the success, which we believe we're going to have, managing this for families in the first 3 counties. And we have really good cooperation from the superintendents in that regard. We think that will be helpful for the state to have more confidence as this continues to develop. I want to say that your question is an important one, but almost an unanswerable one. We are making very difficult judgments here based on the information at our disposal. We have looked at the best epidemiological evidence. We've talked to the experts on this, and we're making tough decisions on this. But I want to talk about why this decision, you just made me think of another reason that people need to think about this. When you talk to experts about the ability to slow down an epidemic, what they tell you is that no 1, 2, or even 3 things can solve the problem. You need to have a broad-based assault on every front. And we believe this is the right place to enter the front of school closures, and that's why I have advised districts to get ready for this in other places immediately, because other closures may be coming.
Governor, are these days that are going to need to be,
we're gonna go this way here.
Governor, are these days that are going to need to be made up going into the summer based on the emergency steps?
So I'm going to let Chris talk about the chronology of that. You want to talk about that?
So we've given guidance to our schools already that this is obviously a pretty unprecedented moment. My office has the ability to waive both instructional hours and school days. We've already indicated to them that they are likely, assuming we make a return to school under the timeline that we have indicated here, that they will be making up some of these days into middle or later June. They also need to prepare, however, for the next school year, and there's some really essential work that goes on in that time. So at this time, we expect some of these days to be made up. We do not expect that, given the length of this closure, that it will be anywhere close to mathematically possible to make them all up. We will lose some instructional time this year in these 3 counties at a minimum.
Chris, how do the seniors make up the credits?
So seniors, we have credit requirements in the state, there's certain amounts of credits. There's some flexibility already in that with the State Board of Education. There are particular classes that seniors have to pass as well in order to get their high school diplomas. They've effectively done most of that their freshman, sophomore, and junior year. Often it's a civics class or something they need their senior year. Part of the recommendation and guidance from the governor and what we will put in our guidance to districts is this complicated notion of making sure that we close our schools for maximum safety, but there is an expectation from some of our educators that they'll do the work necessary, maybe at a distance, maybe portfolio approaches to ensure that seniors are getting the classes and credits completed based on our educators' expertise on their competency to make sure that they graduate. We will continue to reach out to our higher ed partners who are remarkable in this state in terms of accommodating admissions. And our 2-year colleges have long had great flexibility. Our universities have just been amazing across the country, leading the country in this state about lessening the narrowness of their admissions. And so they look at lots of factors, but we will be encouraging them to look at the spring of 2020 as an asterisk, if you will, and being very considerable, taking consideration about how unique this is for our seniors. But we will get them graduated and they will do the work.
Governor, what do you think of President Trump
Essex,
considering a trip ban on travel to Washington State?
Could you just defer just for a minute, because I want to add something. I wasn't intending to talk about colleges today, but since Chris mentioned it, our advice to all school administrators, including college administrators, who have not already closed their on-campus, non-remote learning, they need to get ready for a potential closure as well. Now, we have not had adequate discussions with college advisors to make specific decisions about this, but I would advise college leadership to do the planning necessary for potential closures as well. Essex?
Governor, what do you think of President Trump considering a possible travel ban to Washington State?
Well, I at the moment, you know, on occasion, this president says some things that, you know, don't come to pass and never were going to come to pass, and I hope that that's one of them. We've had no discussions with the White House on this. I've talked to the Vice President 4 or 5 times now, and that has not come up in any discussion. So at the moment, it sounds like a random comment by the President rather than a thoughtful consideration. And I will be talking to the Vice President the next day or so and about several things. I don't believe that's probably going to come up. I do want to mention something because we talked about the ability and the desire to help hourly employees in the school system. One thing that the federal government could help us on now is to do an emergency declaration which opens up the spigot of unemployment insurance to some people who otherwise do not have access to it. And I really hope that the federal government will consider that. They've been helpful. Vice President Pence has been helpful. They did. We do believe we will shortly see some guidance on unemployment insurance to help us. I spoke to the Secretary of Labor the other day about this, and he said new guidance was coming, but we need an emergency declaration to really allow us full access to unemployment compensation, which could help some of these school employees.
Governor, we know that the airports are still operating. What do you say to people in Washington who are thinking of traveling? Should they not do it?
Well, I would say follow the medical advice that we're getting, and I am conveying to you the best medical advice is that people who are of age and people who have compromised health conditions and serious underlying health conditions should really be very, very cautious about exposing themselves to confined environments with many people. And that's the same advice I'd give to anyone for any confined situation. Beyond that, the federal government largely has control of those decisions on the aviation industry. And I just have to tell you, I'll just tell you what I've shared with my family. This is a moment where all of us can be leaders to ask whether we really need to be in close contact in any conditions that are really not essential. Now that's really hard to think about, but it is true. And almost for everyone who doesn't have to be in close contact for the next several weeks at least, I'm advising them to think about that seriously.
Secretary, when you talk about private schools, how did you provide your advice to them? Were they on the conference call? And secondly, I don't know if you have the powers or if it's OSPI, but homeschooling. There may be parents who now want, because of this long break, to become homeschoolers. Is there a process where they could become
I don't know, Chris,
quickly?
do you know about homeschooling?
Could you also talk about the private schools too?
Yeah, so I had a conference, video conference this morning with private schools and helped them understand that it was my understanding that this proclamation would include them. They understand that. We are often in very parallel situations in terms of the safety and health of our students and have a good coordination in that. They appreciate very much the guidance and the consistency around this. Homeschool is a choice that a lot of families make in this state, and they can continue to do that, obviously. It is incredibly about declaring that they're going to do that and then providing resources for them. Our office has some of that. There are lots of other resources out there, and we will continue to provide that for those families and others who make that choice. But there is some process they go through in making that declaration.
6 weeks if they want to
Yes.
become
So we're
homeschoolers?
going through our guidance right now on dozens and dozens of things that need to follow for our districts, and this is one that we will certainly take up and understand how lengthy that process is, who's involved, engage those folks, and if there's a way to make it simpler, we certainly will.
Governor, before closing schools in eastern Washington, are there certain benchmarks for infection rates that you're going to look at? Because, first of all, we're having trouble getting infection rates in some eastern Washington counties, and there's not adequate testing over there in some cases.
Yeah. Well, yes, when the transmission rates and the community spread appears to be at a level to justify the downsides of school closure, we'll make that decision for other counties, eastern Washington and otherwise. Now, that is not a numerical criteria. There isn't any percentage I can give to you because we're really not, it wouldn't be meaningful at this moment to try to develop something for each county like that. So this is going to be a judgment call like many things are in public life, but I am very confident that it is the right decision, the safe decision, the prudent decision, not just for our children, but for their parents and their grandparents, to make school closure decisions when we believe it's going to try to slow down a rampant epidemic. And we are facing a situation where we have to look forward. So we can't be thinking about March 12th. We have to be thinking about May 12th. And on May 12th, we could have, 30, 40, 50,000 people who are infected with this virus in the state of Washington. And I think as elected officials, we've all got an obligation to look over the horizon. This is a decision that looks over the horizon of what our state is going to be faced with if we do not act. So we will act in counties where it makes sense. And I do want to reiterate, that could be in the very short term. That's why I'm really encouraging school districts to start thinking about this hour about what you're going to do if we have to do closures in your county.
Governor Inslee, Governor Inslee?
Oh wait, he had one too, didn't he?
Not every child has a computer and
Yeah.
access to the internet. What about equity here? Are you asking for districts to accommodate that, or what's your solution to that?
Well, we recognize a couple things. One, if we can do distance learning to any effect, that would be great. And if districts can do that, that would be super. But we also recognize that there's very disparate economic conditions and technology conditions and access to the internet at homes. They're very different across the state of Washington. So we can't create an expectation or tell families that you're going to have remote learning at great degree available in every state or every district. You just can't do that. So if schools can do that, that would be great, but we can't create an expectation of that given the disparity in access to the internet and other financial conditions of the districts.
Governor, could you confirm the 40% number of...
I'm sorry?
Could you confirm the 40% number that there are kids in Washington State who are on free and reduced lunch? Is that
Chris will
number
probably
correct
have a
on
better
that?
number. Do you know the number on free and reduced?
Do you know what the
lunch?
percentage is of children who are on free and reduced lunch in the state right now?
Yeah, it exceeds 40%, but we can get you a very specific number.
So moving forward, when can they start getting those meals? I know that the districts are working on that, but any idea of a timeline?
So each district is going to respond as quickly as they can to that. Our guidance will be very swift. By this weekend, they're going to have the initial set of guidance on things like apportionment and things like nutrition and meals. We have districts who are very sophisticated about that right now. They do summer programs. We have districts who do not have summer feeding programs. So there could be a little bit of differences from district to the other. We're going to ensure that they know the money is there, the meals are there, it's not a food supply issue at all. It is a matter of making very clear to them that this will be available through the entire three-county area, and again, expanded, not just those who are currently eligible. This will be eligible for any family who finds themselves suddenly in the need for it.
I want to add something to that. This is something of acute interest to us, obviously, and I've been really pleased what I've heard from the superintendents of their ability to get this job done, in part because there's a variety of ways to do it. The North Shore District, I've been advised to actually have 16 remote pickup points where you can come pick up your nutrition at a remote place, maybe not even have to get out of the car. So there's a lot of creative ways to do it. I think we're going to be able to accomplish this.
If following up on the question about remote learning, it's easy to Monday morning quarterback this kind of stuff. But yesterday there was an analogy made to this is like an earthquake from a science perspective. And there's been so much earthquake planning in this state. Why has there not been more planning for remote learning amongst school districts? Why has there not been a state mandate for that?
Well, because we got to have school buildings for people to go to school, and we took the limited money and we put $8 billion of new money into schools, and we're building schools and hiring teachers. And if we had to make a decision between planning for an epidemic that might have taken 50 years to come here or hiring a teacher, we made a decision to hire a teacher. And that was the right decision. But I do believe these districts have been, I am actually impressed with the planning they've already done for the nutritional support systems. I think they've given a lot of thought to this already. And I hope and I believe we will be considerably impressed with their success. So I'm glad they're doing the job they're doing.
Governor, have you given any more thought to deploying the National Guard? And what is the plan for making testing widely available? I'm hearing from frontline medical workers and doctors that they don't have the protective equipment, even if they have access to the test to do this. Many countries have mobile spots or specific places you go. I haven't heard about that happening in this
Yeah. Yeah, several of the area of our institutions are developing the remote test so you can take the sample. There's two parts of the test, as you know. Take the sample involves a swab in the nose and a little bit on the cheek. And institutions here are developing ways to do that very effectively. So it's just a drive-by sample testing, excuse me, not tasting, testing facility. They then ship that sample to a testing lab, and then you get the result. So for instance, the University of Washington, they have a standalone test sampling where you can go in and have the swab and take the sample. So that's being done. I'm sorry?
That's a small scale, right?
No, it is, and it is building, is what I'm telling you. Other places, there's an outfit, and I'm told in Everett that's looking for a standalone facility so that it'll be easier to do that. Physicians can do this. Virtually every physician has in their office a swab to be able to take the sample in a plastic bag. That's all that's needed.
But they don't necessarily have the protective equipment which they need to wear to do.
Well, I've not been advised that that's necessary for that test, so yeah, we'll get back to you if that is the case. No, testing is taking place. I just checked, and I'm going to hand to you a little later on the capability to turn around the tests at the laboratory. Right now, there's basically no backup at the state lab. We're advised that Quest has a turnaround time of, they're going to get it down fairly quickly, and at the University of Washington, it's within something like 48 hours, and that is building significantly. Obviously, we were disappointed that the federal government's test didn't work in the first instance, but we're doing everything humanly possible on our end to get that testing capability up and running. I'm going to take, National Guard, yes. So the National Guard is on the job today. They're at our Emergency Command Logistics Center and doing a whole bunch of work today for all of these mission statements already. So they're already working on this. As far as being able to have National Guards, men and women in the public, where you see people in uniform, whenever we need that, we'll ask for it. So when people need that kind of service, the National Guard will be there as when it is requested and when it can be useful. At the moment, that really has not happened.
Superintendent Breakdown can stay.
I'm going to say one more thing before I go, if that's okay. I think it's really important not to sugarcoat the situation we are in on either side of the reality scale. We cannot sugarcoat the danger of this virus or the fact that this virus is going to spread in the state of Washington under any circumstance. It is our job to slow down the spread of that epidemic. And we do believe we are capable of doing it if we use these social distancing techniques that we know that work. But there's another way not to sugarcoat this. This school closure is going to be tough on families. They're going to be there tonight trying to figure out childcare. There's going to be questions about when we actually can fully get back. And so this is going to be really hard on families, and we shouldn't diminish that. So I think it's a moment that I hope everybody can pull together. I hope that if you want to have a shining moment where you can help your community, you're willing to talk to your neighbor and see if they can need a hand with childcare or some other, or transportation. This is a moment where we can all be leaders. So far, I'm seeing a lot of leaders in Washington State, and we want to continue that momentum. Thank you.
John, can you answer the testing capacity question and the PPE question? We've got more of that coming in every day.
Yeah.
Yeah, thanks for that. So recently, the CDC revised its guidance around what is needed for caring for folks who might have COVID. And I think you're correct that the N95 respirator was one of those things that was recommended as you were taking samples, which some of the clinics don't have. They don't have people who are fit tested to do that. But the World Health Organization guidelines and everybody else really uses the surgical mask, the standard, face mask. And with that sort of now being the CDC guidance, that should hopefully free that up. So we are encouraging healthcare providers to listen to their patients. If their patients have symptoms consistent with COVID, especially if they're at high risk, to really encourage them to offer the test to their patients.
But to expect a doctor who has an office and other patients to think about and colleagues and staff, to ask somebody to come in and be tested in that office, what if they get a positive? Do they have to shut their clinic down? I mean, shouldn't there be a specialized place or places around the state that do this instead of your own doctor?
So, this is like other things. If you go to your healthcare provider and you indicate to them, look, I might have a respiratory illness, what you will often see when you go is you will see masks at the entrance and ask to mask up, and a hand gel, et cetera. So we are asking people to call their providers first. And as the governor indicated, a number of providers are doing some of that testing outside their clinics. And right now, there are folks who are looking at sort of developing these quote unquote sort of drive-through testing spots, and that's being planned right now. And so we're looking at the experience of some of the healthcare providers who have already done this to see what their lessons learned have been about that.
Mr. Weisman, can you address the positive test at the Tumwater office in the Department of Health and whether you had any contact with that person?
Right. So like many employers who are now having employees who test positive for COVID-19, we at the State Department of Health had an employee test positive for COVID-19 over the weekend. The employee was last at work on Friday and had no symptoms at the time. We engaged the Thurston County Public Health and Human Services, who is our local health department. The individual was reported to that department, and we engaged them. A contact investigation is being done, and like any other situation, the individual was asked for their close contacts, and those close contacts are now not at work, and I was not a close contact.
Can you look at Life Care, for example, when you look at Life Care in Kirkland, it's been almost 2 weeks and those staff members there still don't all have the testing. Why is it taking so long to get testing to the epicenter of this outbreak?
So I don't have all the details on the staff who've been testing. I know many of them were offered, I believe, the test. I'm not sure what their choices have been made about taking that or not. What I can say is all the residents have been tested, but that investigation actually is a local piece, so I don't have all the details on that, but I'm happy to follow up with you on that. I just don't have the details with me.
Can you help in terms of, I'm confused about whether the goal of public health officials is to test a wide number of people, even those with mild symptoms, so that you can understand better how many people have this, how fast it's spreading. Or is the focus on testing those who have serious symptoms and perhaps need to be hospitalized? And maybe you can extrapolate in other ways how widespread this is. But can you give us some clarity about what the goal is with testing? In 6 weeks from now, what will that infrastructure look like? How many people will be being tested? What's the goal?
So the goal in testing really is not about treatment. We need to be clear about that because there is no medication for COVID-19 that one can take right now. And so the goal in testing is really identify people who are infected so that they can know to stay home, stay away from others, and that health departments can contact them to see who their close contacts might be. So it's really that case finding and contact tracing, as the superintendent nicely said. I should make you a public health official in his remarks. So it's about that, and it's also about trying to identify sort of where it might be in our communities. So both of those are the goals with testing. And I would say that especially for those folks who might be at high risk, one of the reasons we are interested in having them test is we still have flu around. And so they can actually go to their provider, and get a flu test or other rapid tests for other respiratory diseases. And if that's what they have, there are actually some medications for that they might be able to take. So that's one of the reasons we're interested in the sort of folks who have underlying chronic health conditions, is really so that if they've got other issues, they can be treated for that.
But if a physician gets a call from a patient and they have the symptoms, do you want those physicians saying, come in and get tested, or stay home and stay away from people and get over this, and unless you need an emergency room or urgent care, it gets worse, I don't need to see.
Right, that's the conversation that physicians are having with their patients right now, and understanding why they would want the test. And as you point out, one of the risks of having folks come into facilities is the potential for infection. And so those things are being balanced by the healthcare provider and the patient about why it is they really need the test or want the test. I think it's no secret that there's not as much testing volume out there as we would like. The governor's been really clear with the vice president and others, and with the commercial companies, that they need to come on board to provide this test. They have very large-scale operations that are all automated, and we are really looking for them to come on board so that anyone who does have symptoms consistent with COVID-19 can get a test if they desire. Given the volume right now, folks need to prioritize, and we're really prioritizing on those highest risk groups.
Can you explain who coordinates the supply of test kits? For example, you mentioned Life Care is a local case. We have the Fed saying that they were prioritizing test kits to Washington State. There's the matter of the University of Washington testing private, commercial testing. You just mentioned the state. Who's like overseeing all this to make sure tests are getting to where they're needed?
Mm-hmm. So in terms of the federal government, they certainly are making sure that as our state lab, that we're getting as much testing, the product to do the testing as we can. The commercial vendors are very interested also in going to the places where there are cases, and certainly across the country, you're seeing more and more states having that. So those are the conversations the governor has had. I've been with him, with companies, encouraging them to prioritize Washington State. And I think it's important to note that some of these companies don't actually do the testing here. They actually send their tests to a lab, a centralized lab elsewhere in the United States. And so that is one of the reasons that the turnaround time for some tests may take a bit longer than some people would like, is that those have to be shipped, tested, and then the good news is the results come back electronically.
So if somebody goes to their doctor's office, they say, hey, I think I need to get tested. The doctor agrees. What then happens? Does the doctor call the state health lab and say, hey, I have someone here that I think needs a test?
It can happen in a variety of ways. Now that the commercial labs are coming on board, clinics usually have a relationship with one of the testing companies for a bunch of other tests they do, whether that's, and so there are a number of large companies. So they're most likely using their normal vendor for their lab tests. They can also order it and send it to the University of Washington or to the state lab. So they do have options.
And then one last question. So then what's the state lab's purview? Like where and when and how are they administering tests then?
Yeah, so ideally, when we have all the commercial labs up and running, the state health department lab, we're very manual. We do not have an automated system. It isn't what public health labs are set up to do. It's not our business. So our priorities really are trying to do these investigations around clusters, and whether it's testing healthcare workers, testing people in an isolated outbreak situation like a nursing home to prioritize those, prioritizing folks in public safety. So our role becomes really more of a public health investigation piece is what the state lab role normally is. And as this testing capacity is coming on board, we are moving more and more into that role.
Dr. Secretary, can you tell us, since we're talking about education today, what are the total numbers of positive tests in public schools and private schools, both students, adults? What do we have in terms of numbers and where those clusters are?
Yeah, so as we have said earlier, that the cases in younger folks are usually much smaller in number. Their symptoms tend to be very mild, maybe so that they don't even realize that they might have COVID. In the current tests that we have done, 2% of the test results that are positive have been in those under the age of 19. So it's a really small number of folks. The vast majority of those who test positive are in the 60 and over category, and that's typical of what we see, I think 50-some%. It's also who we're encouraging to get tested.
So that would be 10 or 15 out of the 400 or so that are on the Department of Health?
Yeah, so there's like 366, I think, currently on the website, so 2%, actually it's, 2% are under the age of 19.
Just to give us a clarification.
Last one for
The
John,
governor
he's
just
got to
spoke
go.
about maybe.
I'm sorry.
The governor said there could be 1,000 cases and that could be 64,000 in 6 weeks. Do you have any clearer sense today of what the actual number is? And secondarily, you have this national stockpile equipment. Are you getting urgent requests for that from county public health offices, from frontline providers? Is there a need for that equipment?
Yeah.
It would suggest that this is in a lot of places and rapidly spreading.
Right. So on the first question, we are working with modelers at our research institutions here in the state. They're doing great work working with us. They are getting samples of the virus of people who have actually tested and looking at the genetics of those and are doing the modeling for us around what we think the situation is. And the governor, I think, yesterday showed that chart at the press conference. So as of about today, we think there are probably about 1,000 or so, 2,000 folks who are infected in the greater sort of metropolitan area. And as the governor also said yesterday, that number can rapidly rise if we're not doing anything. If we don't take any intervention, the modelers are suggesting that by April 5th, that number could be 25,000 individuals. But the good news is we've taken action. The governor and the local elected officials and public health officials met over the weekend looking at all these data and decided now was the time to take a look at restricting public events, as you know, to those no more than 250. We continue to take a look at that. This action around the schools is a similar action that we're taking. And our goal is to see to it that that line doesn't keep going up, that it's a slower acceleration and flattens. And that's exactly what we are working on right now. It's why we need everybody to heed our advice, to take this very seriously. If you have not taken this seriously before, now is the time. Now is the time that if you are not washing your hands well, that you do that. Cover your coughs with a tissue. When you throw that in the garbage can right away, don't leave it laying around. Those are the things that are important. In terms of the personal protective equipment, the personal protective equipment supply is extremely tight. Our healthcare providers are having a very difficult time ordering those supplies. We know that. And the governor has had conversations with the vice president, as I have had with federal officials, about the need for them to increase the production of that personal protective equipment. We have to keep our healthcare workers safe in order for us to address this outbreak.
Okay, we gotta go.
And and to finish with that, the state, when folks can't get supply, then they go through their local emergency management, and if they can't get PPE, then it comes to the state, and we tap into and make requests of the federal government to the Strategic National Stockpile. We've done that now on, I think, maybe 4 occasions and have been receiving our supplies. Thank you.
So that's true. The stockpile is working. We're getting it. It's getting to people. The governor talked to the vice president yesterday about it again, so it's not been a problem.
Superintendent,